tackling a crisis,
This is the time for ASA to step up, take the lead on this.
and building a better future. This is the Anesthesiology Annual Meeting. Welcome to ASA TV. I'm Ed Highland. The Anesthesiology Annual Meeting is the place for thousands of professionals to share knowledge and get important updates. The nationwide opioid crisis has turned into a public health emergency, and physician anesthesiologists are uniquely qualified to understand and manage this threat. This late-breaking session delved into the Trump administration's response and ASA's contribution.
I can't emphasize how valuable it is to hear from my colleagues directly out in the field who are experiencing what is actually going on real time with the opioid crisis. It's vital that our doctors feel like they have a direct line to share that. This is the time for ASA to step up, take the lead on this. There are solutions that are needed. They're needed imminently in the perioperative realm, in chronic pain, and there is no society that is greater poised to right now to help in that arena. The lawmakers are waiting, and the nation is waiting. So I really hope people hear this call to action.
I think it's useful for administrators and people in government to hear from the people on the ground the extent of the crisis, and from our perspective, which as anesthesiologists we see all the patients who are affected by this crisis.
ASA has taken a leadership role in tackling the opioid crisis, and this session provided an update and recommendations to continue the progress made. Not only are physician anesthesiologists being urged to educate patients about the safe use of prescription opioids, but to utilize effective evidence-based prescribing.
The interesting thing that I thought was, I came to one of these conferences about 5 years ago, and that's when the epidemic really became quite prevalent, but there have been measures instituted which have decreased the incidence of opioid prescription. I think the most common, or at least the most sensible thing that was discussed there was the fact of limiting the number of tablets that could be prescribed and to use the minimum amount of dose of medication for the minimum amount of time. And I think in our country that's becoming a bit of an evidence as well, in that you shouldn't just prescribe medications ad hoc. It needs to be taken individually, and I think the results that the presenter gave forward is that they are having some success.
The SAMBA panel, the Society for Ambulatory Anesthesia, presented the latest studies on opioid use and abuse. Research shows up to 75% of misused opioids come from leftover prescriptions. Could some of the epidemic be curbed before the patient even heads home?
If each patient comes for a carpal tunnel and they leave and they end up with a surplus of somewhere in 15 to 17 pills, and you do 100 carpal tunnels in your surgery center, and you're not even touching them because they're all done under local, but you're a stakeholder in the ASC and you sign off on your DEA license for holding the meds, there's a disconnect here, and you have to start to ask, where do policies and procedures really reach?
From geriatric care to professional issues, the Anesthesiology Annual Meeting covers topics across 12 clinical tracks.
There's an abstract in a spine journal from Children's of Los Angeles where, by a very similar protocol, achieved a length of stay of about 3.7 days.
The pediatric track featured this program on enhanced recovery after surgery. Adapting a RAS for infants, children, and adolescents requires different considerations, from disease-related risks to family engagement in recovery.
We already do an enhanced recovery program for some of the things, and it's given me more ideas.
The big data is going to get better. Big data is going to be able to track complications, and you'll see the incidence fall.
Obstetric anesthesia creates unique challenges, but the Gertie Marks Plenary focused on how far the profession has come and how ASA members can improve the future. Dr. Robert D'Angelo issued a call for action to build on the success of the Anesthesia Quality Institute and the National Anesthesia Clinical Outcomes Registry, or NACOR, by contributing cases to the Anesthesia Incident Reporting System, or AIRS.
I think we all go through that thought process when we have a complication. One, we don't want to be alone, and we like to realize that all of our colleagues and friends have been through this before, and we always want to try and improve the care that we're delivering to our patients. So having an opportunity to report that information and use that information to improve our care ultimately does give us some satisfaction and hope that we can continue to deliver that high level of care that we aim to.
The new reporting means you'll have to select quality measures and improvement activities for your practice. More information is available on the ASA website. Go to asahq.org/MACRA. The Anesthesiology Annual Meeting features hundreds of education sessions and hands-on workshops, but the learning continues year-round with simulation education. Attendees explored the newly launched Anesthesia SimStat. The virtual operating room is brought to you by ASA and CAE Healthcare and provides practice before performance. The continuing education modules can be accessed anytime on any laptop. The trauma module is the first available, with appendectomy and robotic surgeries among future offerings.
I came from the Philippines, and there we have at least the technologies that you have right here. Many of those technologies, we don't have it there yet. So I think it's very important that we have simulations so that we could educate a lot of people there, teach them new technologies that may not be available, or to have equipment that's not yet available in the Philippines and try to expose them.
One of the tricks of simulation is that you have to give in to the experience, because when you give in to the experience, you will feel the stress of based on my experience in simulation, you will give in to what is happening, and you will want to improve what is occurring if it's not going as planned.
From corner to corner, there are robust conversations that affect how physician anesthesiologists practice and patient outcomes. Post-operative cognitive dysfunction has spurred some debate. It's only here at Anesthesiology 2017 that attendees can delve into research and literature that will help shape their approach. ASA launched the Brain Health Initiative to take on this challenge. You can learn more at asahq.org/Brain Health Initiative. Physician anesthesiologists often find themselves in positions of leadership in and out of the operating room. And in order to develop those skills, sometimes you need to have some fun and play some games. This introductory workshop had residents working in teams to problem solve, playing the cooperative board game Pandemic.
This particular board game, there are 4 diseases that are spread across the game board, which is considered the world, and the 4 participants need to cure each of the 4 diseases in order to win the game. So what we're hoping they learn is, in a non-clinical setting, but in a medically relevant game, they'll do something cooperative, so they work on thinking about common goals, backup behavior, mutual support, cooperation, communication, all of the tenets of teamwork that we'd like them to learn about and use in their daily clinical care, but they don't get a lot of time to actually practice and get feedback on.
We want to have them walk away appreciating that most of the negotiations they're going to be dealing with in their career are going to be cooperative negotiations, where they're going to have to work with others in the long term. Ultimately, the goal is to get the pie expanded and get everyone to get a little bit of what they want, and teaching people the strategies to get there.
You can catch up on all of the ASA TV segments online. Just head to goanesthesiology.org or on YouTube at Lifeline Patients. For ASA TV, I'm Ed Highland.